continue to stay here and cover with our team coverage live in Lansing. Rick Albin, as you pointed out, to the governor's orders, pardon me, I'm trying to get used to the new normal, presumably for miles down Michigan and Capitol. We'll continue to stay here and cover to the governor's orders, pardon me, very early this morning. In fact, as you pointed out, I'm trying to get used to the new normal, to the governor's orders, pardon me, very early this morning. In fact, as you pointed out, I'm trying to get used to the new normal.
Safe. And now the governor and I are pleased to answer questions.
Thank you, Secretary. Our first question is for you. From BeaverCountyRadio.com, do you think the mask and glove requirement will be heeded?
So there actually is not a glove requirement, and the governor and I strongly feel that Pennsylvanians want to do the right thing, and Pennsylvanians will do the right thing. And then when they're going out, they will wear a mask, and that businesses will require masks when customers are coming into their business.
Need the masks are those individuals that are currently sick with coronavirus. If they wear a mask, that will prevent those droplets from spreading elsewhere and prevent other people from getting sick. Healthcare workers taking care of a patient with coronavirus in close contact with someone for a long period of time needs to wear a face mask to protect themselves from getting those droplets in their mouth or in their eyes and then getting infected with the coronavirus. A healthy individual out walking around does not need to wear a mask to prevent getting the coronavirus.
I'm Dr. Travis Stork, host of The Doctors, here to talk to you about the coronavirus COVID-19. There's currently no vaccine to prevent coronavirus. The best way to prevent illness is to avoid being exposed to this virus. The CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including coronavirus. Face masks should be used by people who show symptoms of coronavirus to help prevent the spread of the disease to others. And if you think you may have been exposed to COVID-19, please contact your healthcare provider immediately. For more information about the coronavirus, log on to cdc.gov.
As more people show concern about the coronavirus, we want to make sure you get the answers you need.
And that's why we have called in the experts for a virtual town hall. And let's check back in now with health specialist Denise Tedor and the team of doctors from UCLA Health answering your questions right now in our Content Command Center. Denise?
Well, Michelle, exactly right. What we want to spread here during this town hall is information, because that is the best defense against what is going on right now. We want to keep you safe. Dr. Lisa Dabby, you're an emergency medicine specialist. We have a question here. We're getting a lot of questions about masks. Which ones work? Who should wear them?
That's a great question. So the CDC is actually not recommending wearing masks. We find that when people wear masks, they actually touch their nose and their mouth more than they otherwise would, which is how the virus is transmitted. So take-home message would be not to wear masks in public. We do use masks just in the ER when somebody is contagious and coughing to cover their cough so that they don't aerosolize the virus to other individuals.
All right, thank you, Dr.
Do masks work?
Masks work up to a certain point. They block physical droplets, like big chunks of cough, from hitting your face. But they don't necessarily screen out sort of the smaller particles. Viruses and bacteria can go into your eyes. People don't use masks properly. They often sort of adjust them or touch their face. So up to a certain point, they could do a little bit, but really you're better off washing your hands and not touching your face.
Right now in Berlin, there is a report. In Manhattan and, of course, greater New York City, there is one, maybe two reports as well. How should our viewers and listeners adjust to that? How do you adjust to the day to one report in a given multi-million population city?
You just have to be, you can't stop this virus, really. It's like stopping the wind. You have to just be sensible and take precautions, but life goes on.
We are Where Atlanta Speaks, of course, and we are committed to answering your questions about the virus. The outbreak has many of you asking, do I need to wear a face mask? The answer, no. The CDC does not recommend the routine use of face masks in the community. Instead, it wants everyone to avoid people who are sick. Avoid touching your eyes or nose and cover your cough or sneeze with a tissue. People who are sick should stay home and not go into crowded public places or visit people in hospitals.
If you're making a mask at home, consider buying materials online to avoid having to go out. And construct your mask out of 2 layers of tightly woven 100% cotton fabric. Now, clean your hands with an alcohol-based, see if we get it out here. There you go. Hand sanitizer or soap and water before putting your mask on. Don't wear a mask if it's still damp. Your mask should fit snugly around your mouth and your nose. Let's see if I can get this right.